was the one getting radiation.
That's cool.
Yes, but her husband died. But she's still my friend.
Not
So
as
we're doing
cool.
yeah. So we're doing lunch in between my MRI and my nuke bone.
Nice. Where are you guys
Yeah,
going for lunch?
right by MD Anderson is Cracker Barrel.
Oh, okay.
So why not? It's literally right there.
Mm-hmm.
That is one thing we don't have in California or in my neck of the woods is Cracker Barrel.
No
So
Cracker Barrel, huh?
yeah, no, no, and I've only been there like once or twice when traveling. So yeah,
Yeah.
it's a serious lack that we have here in California.
It's a nice country place.
Yeah, yeah, yeah.
That's good breakfast food.
Hmm.
I like it. You meet cool people along the way.
Yeah. Your
Hmm.
your cat's so cute, just like kind of hanging out right there.
What's interesting, she was a feral cat. So I am a cat lady.
Yeah.
And I took 6 months and I tamed her. She was a street cat. She's missing a tooth. She's got the clipped ear.
Uh-huh.
But now she will demand your affection and attention. And how dare you try to sleep, not pet her? You know, it's to your hair.
Yeah. Well, that's awesome.
Mm-hmm. Yep. She was feral and it took a while for her to love me.
I can imagine.
Yep. And now she's marking my cup.
Of course. It's hers, by the way, and she's just
Apparently.
holding it to you.
Yes.
All right, let's just give it maybe two more minutes. Thanks, Ed. That's great for sharing that.
Yeah. I posted your Facebook page where you've
I saw.
documented
If
that.
you don't
Yeah.
mind.
I do not mind.
Public page.
I choose to live openly and it's pretty cool.
Yeah. Well, you it's wonderful for you to do that because there's so many people who are going through breast cancer
Hmm.
or really any cancer and
Yeah.
so having people who have experienced that and can give support guidance etc I think is just incredibly valuable.
Oh yeah. There's all kinds of pictures and everything. They can see and look at and realize and they
Yeah,
went through it with me on my
yeah,
page.
yeah. No,
Hmm.
that is huge. Yeah, I know when I was diagnosed, I did it kind of the same thing. I sought out individuals, in
Hmm.
my office at that time we were still in office
Yeah.
to talk to and just kind of
Hmm.
learn what you can learn and get guidance, help, support, whatever it may be. So, uh,
Absolutely.
and of course, while you get support from friends and family, those people who have gone through it
Hmm.
I provide so much valuable guidance and information.
Information.
Yeah,
Yes.
information is huge. So,
Yes. Agreed.
all right. I'm just looking at it. Yes. Cool, cool. I think why don't we go ahead and get started? A couple minutes after, I would just want to welcome everybody. I reserved an hour and we may take it up or we may, wrap earlier. But I want to give you just a welcome. And in case you don't know, October is Breast Cancer Awareness Month. And so we really wanted to share a little about Aubrey's journey. And I'm going to let Ed introduce his sister Aubrey and say a few words, and then we'll just jump on in.
I am. I'm Ed Heiser, president of GoDaddy Abilities, and we wanted to put together an event for breast cancer awareness, and I suggested that my sister Aubrey Clough uh, be a guest speaker of ours, where she could share her adventures with her fight with breast cancer.
Is it my turn?
Yes,
Yes.
take it away.
Okay. Hello. I am Aubrey Clough. Ed is my brother. If you know him, you love him. He's extremely sweet and extremely intelligent and very helpful, and he always tries to be there for you. So, I have breast cancer. I have stage 4, triple positive inflammatory breast cancer. So, what does all of that mean to people who don't know? So, breast cancer is usually ductal or lobal. Um, Mine is in the duct. I had a damaged duct from breastfeeding my kids. And that's when they got cancer in it. So, triple positive. What does that mean? So, triple positive is the 3 things that can feed breast cancer. So, there's estrogen and progesterone. Those 2 things are hormonal. Usually, if they have those types of cancers, it's less likely to recur and it's less likely to deform your breast. If you're HER2 positive, it is more likely to deform your breast. So it's like super obvious you got cancer. And it's more likely to recur. And then I also have inflammatory, double whammy. So inflammatory means that the breast swelled humongous and was pink. Only 3 to 5% of people that get breast cancer have inflammatory. It's also more likely to recur. HER2 and inflammatory, it's more likely to spread. Also, they're more aggressive. So I got the double whammy. If you want to look at the mortality rates on inflammatory, go ahead. It really sucks. Pretty bad. So my journey, so that's the triple positive. So, and the inflammatory. So mine is stage 4. Stage 4 means it metastasized. So it not only went to my lymph nodes, it was in 8 out of 10 lymph nodes. And then it spread to 3 places in my skull, in 2 ribs and my sternum, and all throughout my thoracic, lumbar, and sacrum spine, all over. So that's me. That's my cancer. But I would like to say your attitude has a big difference also. So they've actually done studies, and I'm a talker, and all of the nurses know me, all of the people, they all know me. It's fun going to the cancer center, actually. And in talking to one of my lymph node massage ladies, they're awesome. It's like my favorite service, my favorite appointment. It's because I get to lay there and talk and be massaged on. It's kind of cool. But it is necessary, but a luxury. So I was talking to her, and they have master's degrees. They're really smart. But her thesis was actually on the attitude of people who have had cancer. And her study was people that have the same cancer, the same demographic, the same everything, and the same treatment plan. The only difference was people who chose to be antagonistic, negative, and then people who chose to be happy and positive. And even though they were the same staging, the same everything, the people who chose to be happy and positive usually did better than even planned. And the people who did not, they usually went downhill, let's say, and didn't do too well. So attitude is huge, 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 huge. I choose to be happy, and I choose to laugh, and I choose to be positive. And even when I got my port in, I went to the movies the same day. Because do you know what? I feel like life is too short, and life after going through this is all about making memories. And it teaches you what matters in life, the people, and you have to have a big why. Like, why are you doing this? Why are you going through this? Why are you choosing to suffer? And in my opinion, there is nothing that I wouldn't do. There's nothing that I wouldn't go through, and there's no pain or anything I would suffer to be with my family. They are my why. I have a husband and 2 kids. They're 7 and 8, and I have my brother and my parents, my sister-in-law, my nieces and nephews. And there's nothing I wouldn't suffer for them. So, in August last year, I went to my OBGYN, and so I have no boundaries. I have no filter. So I'm not going to tell you all the nitty gritty, okay? So I went there because my left breast was humongous and it was pink. And where the cancer was, it looked like orange peel skin. You can it seriously looks like orange peel. And also when you have that kind of cancer, your nipples are they're beyond inverted. They cannot come out, okay? So that's a big sign of cancer. You literally it won't come out. So I went to my OB in August and I showed her and she was like, that's really bad. And I was like, yeah, it is. And so she said, I need to get a diagnostic mammogram and ultrasound. So I went and it took a month to get that appointment. So now it's September and I got my mammogram. And if they tell you to go sit in this little waiting room and then they call you back 4 times, that's bad. In my experience, I have learned if they're like, oh, we need more images, that means they're looking at something it's not good. So I went back 4 times and she did tell me that there's tons of calcifications. And my breast was very, very, very dense because it was inflammatory. It was full of fluid and calcification. So calcifications, a little bit can be normal. Hormonal during your period, whatever, you can have those. But if you have it's dense and you have a lot of them, those are grown from the cancer. So I did that and they said it's not good. And then they told me to go to the ultrasound. And when I had my initial appointment, they said, you may or may not go and do the ultrasound part, depending. Well, 4 scans mean you're going to that ultrasound. So I went and got the ultrasound and they did imaging. And then I got to just lay there and wait. And then they did more imaging. And then while I was sitting there, I got a phone call literally while I was in the ultrasound room from the doctor. Diagnostic ultrasound mammogram means there's someone in real time looking at your images. That's also why it can take a little bit longer because there's actually a doctor looking at them and a doctor needs to be there to look at them the whole time. So while I was sitting there, I got a phone call and they basically said I have a 95% chance of having malignant cancer. So then they said I need to get a biopsy. And so let's say at first I was like, so if it's a 95% chance of cancer, why do you have to biopsy it? I was like, can we just forgo that and just chop it off, That was my thought process. Okay. But we did research and I talked to doctors and they actually need to biopsy it so that they know what is growing it, so that they know how to treat it and they know how big it is and all these things. Okay. So it was going to take 6 weeks for me to go through Simon Med to get my biopsy because they were doing 2 different kinds of biopsies because they also saw there was cancer from my lymph nodes in the mammogram images in the ultrasound. And also here's a good detail too. They do know from the imaging if it's cancer or not. So if it's a nice, pretty little circle, no, it's not cancer, okay? Mine looked like a person stretching out their arms and their legs, like a dude just chilling, leaning out. You know what I'm saying? It had arms and legs in my cancer, okay? When it's a funky shape, that's cancer. If it's like a nice spherical, like uniform look, it's not cancer usually. It has to be a funky shape usually. So mine was like a person in there chilling. Um, so they said it was going to take 6 weeks, okay? But my brother is Mr. IT man, which means that he can Google better than you. And so he goes and he does all of this research and he does all of these studying. And he's super good at that. Our parents, my mom actually, whenever we had a question, she would tell us go look it up. So we got really good at going and looking it up. So he went and he Googled and he researched and he found out that MD Anderson is actually amazing breast cancer center. So for fun facts, everybody that works at MD Anderson has worked at the Mayo Clinic for a minimum of 10 years. So they are like the king of the oncology nerds, okay? Like they're really, really smart. Okay, they have tons of experience. They're at the top of their class. They're also the leaders in immunology. If you want to look up a really cool movie, it's on YouTube. The guy who's the head of MD Anderson Immunology is, I believe his name is Jim Allison, if I remember correct. And his movie is called Breakthrough. He's really cool. And fun fact, he actually is the one who started the immunology for cancer. And he found a treatment in 97 on how to teach your body to kill cancer. Because there's T cells in your body, which is your immune system. And when it goes and probes the cancer cells, the freaking cancer cells probe it back and say that they're safe. They send the signals back to us saying, oh, we're good, we're safe, don't fight us, right? And so he learned how to block that signal going back and then how to teach it to say, we're bad, attack us. And then he taught the immune system how to attack it so they never had that cancer ever again in their life. Their immune system was taught how to fix it. So that's what he does, Jim Allison. He's really cool. So I went there. So I called up MD Anderson because of my brother. And I went there and they looked at all my images, all my scans, and she said she would be shocked. Her name was Audra Zachman. And she said she would be shocked if I didn't have cancer. And to prepare myself, and I mentally already knew I had cancer, it's fine. And then she said that they could get me in for biopsy the next week. So that was a month to do all that. So instead of 6 weeks, it was a month because I chose to go to MD Anderson. And it's a blessing that I moved here. My husband and I were in Utah for my husband's job experience for a little while. We moved back here and we bought a house and we got it all fixed up. And we moved in the end of July. And then I started my cancer journey in August. But MD Anderson is only like 30, 45 minutes away. And they are top-notch doctors, like blessings. And I love looking back and seeing how things fall in order in place. And I love looking for silver linings. That's one thing you'll be learning. So, huge blessing. So I went there and I got a biopsy. That stuff is archaic. Okay. So they had to do over and over and over mammograms on me, back to back to back to back. I had a minimum of 10. Fun fact too, when they're doing the mammogram and you're just sitting here staring at the machine, they have a digital sign there looking at how many pounds of pressure they're putting on your boob. Okay? I had a very large, very pink, very dense boob at the time. Okay? There's nothing right here. So it was 45 pounds of pressure. I think they were trying to pop that cancer out. Like it was like going to leave me. Okay. But they're doing it for a reason. Okay, so they're doing that because they're finding the perfect angle and the perfect image. And then they actually had a nice little marker and they drew a marker and was like, exactly right here is exactly where they need to go in and all of that. Okay, so after your boob has been squeezed like a dozen times, 45 pounds of pressure, they take you into a room and it's a table and it has a hole in it. And you lay on the table with the hole and you lay on your stomach and they grab your boob and they pull it through this hole. And then they put this nice little another mammogram machine clamp on your boob in this exact spot. But I'm so special that machine decided to restart. So I got to lay there extra long, clamped. And then they numb it, which is fantastic. Okay. But just because they numb it doesn't mean you can't hear. Okay? Because when they drill into your boob, it sounds like, when you're getting your teeth done and when they're drilling, and then when they're drilling, that's what it sounds like. And then when they suck the saliva out of your mouth, that's what it sounds like when they're sucking up your breast tissue. And you're just laying there and you can't move. Okay? So whenever you hear of these women having to go and get biopsies of their breast, that's what they're going through. Like it is numb, but like you're hearing these sounds and it really sucks. And then I had it in my lymph nodes too. So then, and by the way, there are these cute little pink tie gowns that you wear. I'm really friends with those. You can look at my little page and see what they look like. I've worn that cute little pink jacket a million times. So then you lay on this table and they do an ultrasound. And this lady was like, ooh, you have lots of little glitters shining in this. And I was like, oh, thanks, fun. So I'm a jokester. And I was like, so you're saying I got boob glitter? Woo! Because I'm weirdo. And I like to do comedy and humor to help situations. That's my coping mechanism. So then, have you ever heard a hole puncher like that? That sound? When they're doing a diagnosis in your armpit, it sounds like a hole puncher. Okay? And I got 8 hole punches out of my armpit. And the next day I went back to work. And so I had bruises all over. And I'm a barber, by the way. And so that was fun. And so that's the diagnostic stage. Okay. It was then and that was happening in October. So on November 1st, I got a phone call from Miss Audra Zachman saying that I'm positive for breast cancer. And then I was going to be meeting with the oncology team at MD Anderson. My surgeon, who I like to call my cutter, she is Brittany, I think it's Goodman. I just had a brain fart. Sorry, it happens. Brittany Murphy. Sorry. Her name is Brittany Murphy. She is the cutter. She is really, really good. She's very educational. When I met with her, and from all those scans and images they had, they said they thought I was stage 2, maybe 3, which they based that on the size. And then because it also stretched my lymph nodes. So they were saying it's like 2 or 3. And then I met with a radiologist. I fondly call him my poisoner. His name is Hung Kong. And he is a very brilliant man. And he is extremely educational. He is like, when you leave there, every single time they give me packets. I had all these packets. And I'm one of those people who I read them packets and I research and I learn. Okay, that's how I learned so much. And he had me do all these MRIs and CTs. Okay, MRIs is when you're going into the machine, and you've seen them in videos, and it's fully enclosed, and you hear that bump, 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 bump. And I didn't think I was claustrophobic. I'm claustrophobic because it's like touching you everywhere and you cannot leave. And they're like 30 minutes to an hour, depending. It's awful. The CTs are super easy. It's like a half circle and you just sliding in and out, and there's like, oh, stay still, whatever, like back and forth, back and forth. It's like only a few minutes. It's not a big deal. However, when they do contrast, fun fact, contrast makes your throat warm and it makes your downstairs warm too. That's a different sensation. But that's what that's like. And so I had all those tests, and then Mr. Kong, he was like, he was saying, "Oh, do you have any pain?" Well, I'm also a barber, and I am not the most petite girl in the world, and my back always hurts me all the time. And he was like, "Well, is that different?" I was like, "No, it's not different. Like, it's just like more, but like my back always hurts." And he was saying he doesn't want to do a bone scan because he doesn't think I have a problem. Well, in my opinion, how do you know unless you tested it? So I was like, you've done all the other tests. Like, I would really like to have my bones tested because you don't know until you've tested it. And so he said, fine, for your peace of mind, we will have you do that test. And so he scheduled me for chemotherapy. And so you do chemotherapy first, okay? Chemotherapy, I like to call it a shotgun, okay? It's like a shotgun effect. Chemotherapy attacks every single fast-growing cell in your body. That's why you lose your hair. That is why a lot of people lose their nails. Mine are just breaking all of the time. And one of them lifted my nail beds. I don't know. I had nosebleeds. I had muscle spasms. I was getting like sores on my tongue. Oh, you lose all your taste buds. Your taste buds are one of the fast growing cells. You lose all of your taste buds. So like all those white things on your tongue, they're all gone. And then there's like big black those big pink bumps on your tongue that you can only see like in the back. That's all that's left on your tongue. That's it. So that's fun. So he first gave me chemo, and he had me on 3 different kinds of chemo. And chemo is supposed to shrink your cancer. That's why they do it before they do surgery. They want to shrink it so that way their margins on what they have to cut out might be less and all of those things. Okay. So that's what chemo does. Also, fun fact, one of the other fast growing cells in your body is your brain cells. So chemo brain is like pregnancy brain, but like a little extra. But pregnancy brain is also because your body's making cells for your baby, not you. I can go on tangents, sorry. So that is what chemo does. So I had my first chemo treatment, and then I had a nuclear bone scan. So first they nuke you, they inject you with this nuclear stuff. Wait 3 hours, and then they scan you. And again, it's like a CT table. It's like a half dome, but it just slowly moves your body, and you can't move because they're doing images of your bones the whole time. So it was all positive for all those places. And then they had to get rid of one of the treatments because it's bad on your bones. So when you get chemotherapy, the first 3 days, you actually feel fine. They give you medicine to deal with your nausea. Mine was going down, not up. But you need lots of ginger, okay? You need tons of ginger. You need like lots Imodium for me. They also have these pills that starts with an I. I could look at them, but it's also to help get rid of acid. They that's interesting about the MRI. I saw that and I got on a tangent reading that. Cool fun fact about the MRI. I like that. So those are the kinds of things that you're going through. You're really weak, but for the first 3 days, it feels like nothing. While they're pumping it into you, it feels like nothing. And it's a humongous room. It's a humongous floor with at least 30 people getting chemo also. Like, you're just in booths. Everybody has its own little booth and everybody's just getting poisoned, all of us. Some are every day. Some are once a week. Some people's chemos are 1 hour. Some people's are 3 hours. Some people are 8 hour. Mine was 2 hours and it was every 3 weeks. So for the first 3 days, because of all of the medicines that they're giving you during, you don't feel bad. But you are excreting it. So like you can't go kissing anybody. People can't like eat off of your silverware or all of your stuff because you're excreting it for 3 days. But after the 3 days, it's now out of your system and now your body's just wreaking havoc after. So for the week after, I was really weak and really queasy and yeah, that's what happens. But then for the next 10 days, I felt completely fine. And so I go back to work for those 10 days and then we start the whole cycle all over again. Mine, since I'm triple positive, I have a HER2 shot. The HER2 shot's in your thigh. And there's a picture on my page for that too. My thigh, it starts out with like a lump in it, and it's a 5-minute shot, and it burns the whole time. And then for the next 4 days, I have like a 4-inch diameter, like all the way around, big red mark on my thigh that's really, really sore and tender for 4 days. And I get that shot every 3 weeks still. So that's fun. So after the chemo, so you're doing chemo. I started chemo in December. I had it 2 times in December because I'm really lucky. Those muscle spasms were happening for the first time on Christmas Eve. I was trying to do my kids' stockings. That sucked. So then what did the chemo do? So there's pictures on that page that my brother shared of me losing my hair. I lost 80% of my hair after 1 dose of chemo. But I got new experiences. Okay. So I am a barber and I now know what it feels like to have clippers on your head. When it gets around your ear, like it's like buzzing, like vibrating. I never had that experience. So I can say I've had that experience now. I know what it's like. And then we do straight razor shaves. Now I know when we do a hot towel and then a cold towel on the men's heads when we're shaving them, they're being babies. The cold feels good. Like I never had the experience before, but now I can be like, it's good. We're in Arizona. It's hot. You want that cold towel. But it feels really like soothing and like I now know what it feels like. So I've had that new experience. So that's fun. So now I can tell the men I know what it's like. And also I was able to be bald during summer. Like that is so good. And do you know how fast my showers were after not having to deal with like shampooing and conditioning my hair anymore? I could do bar soap or gel all over, boom, boom, boom. I'm done in like 5 minutes. So then my husband taking 15 minutes in a shower, and I'm like, why are you taking 15 minutes? I can do it in 5. Like, come on. Okay. So I've had all of these new experiences. I have saved money on products. Another silver lining. So after all of that, oh, and I also got to get these like new little like head scarves and hats. I've never worn a hat before because my hair was curly and froofy. So if I put a hat on, it'll be like a hat and then a poof of curl. Like, I don't want to rock that look. But now I have like hats and they're all blingy. So that's been fun. And now also I have short hair. People can actually see my earrings. So that's good because you couldn't see the earrings under my mane before. So, all fun things, all new things. And now I'm having to try to deal with like men get worse bedhead than us ladies, okay? Because now my hair is shorter and when I wake up, my family, we're weird and we sometimes take pictures or videos and show each other our bedheads, okay? My dad usually wins. Dad usually has the worst bedhead ever. But I think I've been able to beat him now. Some days I wake up and I look in the mirror and I'm like, whoa, okay, that's not cute. But it's fine. So I had chemo and that ended in March. And my amazing sister-in-law, Desiree, Ed's wife, she also does vacation planning. She's really good. She decided, yes, my brother shaved his head for me, you guys. Isn't that so sweet? Sorry, I'm backtracking. Woo, rewind. So, my brother, he was loving his long hair and he shaved his head for me, so I wasn't the only bald one. And my dad shaved his head for me. And my husband shaved his head for me. That's the cool thing about going through cancer, which I know is really going to be weird. I have had some not great experiences in my life. And it kind of made me see ugly sides of people. And it I guess it made me it made me close off to a lot of people. It made me have more walls, more boundaries. I was harder, if that makes any sense. Because the people that should have been there for me weren't, and like I had a lot of people turn on me, which was never my brother or my parents. Okay, let me just put that out there. But everybody else outside of my immediate family. But then going through this experience, I chose to be open. And I chose to be open because I have also been through another hard experience and I chose to be silent. And being silent, it makes you like suffer in silence. It makes you very isolated. And like if you're weird one day or if you're sad one day or if you're closed off or whatever, nobody knows why. Okay? And from that experience, I chose to never do that ever again. And so I feel like when you go through hard things, when you go through different things, you can. I choose to always think, what can I learn from this? What am I supposed to learn? How am I supposed to grow? And so what I learned from that experience is to never do it silently and to never do it alone again. And so through this, I chose to be open. And I chose, if you look on that page, I chose to put every picture, everything. You can see positive stuff and you can be like, this is freaking awful. Like you can see all of it, okay? And I chose to be very open and very honest. And in doing that, I feel like it educates people and it helps people. And so because of that, I like educating people and I like teaching people and I like people learning from my experiences. And then it also lets you see how many people actually care. Like people on my Facebook, I've known them in high school. I worked with them a while ago, whatever. People care more than you think. And it opened my eyes to that. And people's willingness to show up for you and people's willingness to help you. It's amazing. And it softened my heart back up. And it helped me see the goodness in people and the goodness in the world. And like this girl that I hadn't talked to since high school, and we were friends in junior high, and then in high school there were so many people. But she seriously just showed up after I had chemo one day, and she just bring me soup. And she had to drive 45 minutes, and she just bring me soup. Like, who does that? People like drop off goodies at my door. I have a neighbor across the street. She like brings my family dinner every once in a while. And it's amazing the goodness in people. And so choosing to live openly, you're allowing people to be there for you. You're allowing people to care for you. And then another thing that I learned also is to allow people to help you and allow people to serve you. And that is number one. It's like humbling you and it's blessing you, but it's also allowing the other people to care about you, and it's allowing them to show their love to you. And so yeah, don't suffer in silence. Don't go through things in silence, and live openly. And then you get to see the good in people. And it's been pretty amazing. So to again talk about that. So my sister-in-law, after I was done with chemo, she booked a girls' trip. So she paid for me and my mom and her to go to SeaWorld, which is one of my favorite places. I love animals and the rides and everything. But here's the downside. Because I have cancer in my ribs and my spine, I can't do my roller coasters anymore. I love them. I know it's like really petty, but that's the thing I'm pissed about. Like, I'm fine with losing my hair. I'm fine with being a unicorn. I only got a one boob. I'm a unicorn, okay? Like, whatever. But I can't do my rides. Like, it took my fun. Like, that's the part that really annoys me, okay? So they didn't ride any rides because I couldn't ride. And I was like, it's fine. I'll hold your bags, whatever. But they didn't do that. So we went and saw all of the rides, and my sister-in-law paid for the whole trip. Isn't that so sweet? And nobody there noticed that I was bald because I wore this cute hat that had this bling on it. Fun stuff. So we did imaging after the chemo, after that rat trip, and my cancer in my breast, all it did was break it into two smaller pieces. So it shrunk it and then it broke into more pieces, which is not necessarily great, but it did shrink it. And they thought that it had gotten rid of all of the cancer in my lymph nodes except for one. And they did genetic testing. There's 72 genes for hereditary cancer, 72. And I was negative for all of them. So I'm luckily unlucky. However you want to look at that. But at least I know it's not in my genes. I didn't pass any bad genes to my kids or anything. But yeah, so that's why I'm only a unicorn. Because when they chop your boob off, you will never feel it ever again. Like if you touch in certain spots, I can't feel it. And also the back of my arm, it feels like it's tingly asleep, you know? So they had to chop off my boob. They only took one because I want to feel the other one, okay? It's part of life. I don't want to be numb on both sides, okay? That would suck. So they took off one and they took out 10 lymph nodes. Brittany Murphy is an amazing surgeon. And I guess there's 3 levels deep that they can go, but most surgeons can only go 2 levels deep. Brittany Murphy went 3 levels deep, and she said that she was literally peeling my nerves off of my lymph nodes and cutting out the cancer because 8 out of 10 had cancer. So that caused nerve damage, like nerve pain, okay? If you have ever had nerve pain, it's on a whole nother level. And normal pain medications do not work. do not work. And so they gave Oxy, they gave gabapentin, but I'm going to tell y'all something. Weed can do it. Okay. Those kind of people. But I at first was allergic to the I at first was allergic to the nausea medicine that they give you. So my first chemo was really, really bad because I was super, super nauseous and I couldn't have the anti-nausea medicine. And we went to Flagstaff and I was suffering and I was constantly going to the bathroom. We did the North Pole experience with our kids, me, my brother, and my parents. And my brother's like, let's go get you some, let's go to the dispensary. Let's go get you some stuff. And so I was like, I'm doing it. And so I went and I got me some gummies and I went and got me a tincture, but I only used the gummies at first. But I mean, okay, it's a plant, it's made by God, okay? It's like not man-made medicine. It is so good. Okay? And it will get rid of your nerve pain. So I got that. And that stuff is like one of the best things to deal with nerve pain. Nerve pain is a whole other level